Hi, this is Francesco Rulli. I'm the CEO of Querlo. I'm also the Forbes Insights AI Solution Business Partners. I'm here with David Duplay. He has a very interesting series of roles. He's a chairman and CEO of Vital Options International, and also the founder and CEO of Medtera Healthcare Intelligence. So David, if you can give us a brief introduction about your roles and the companies that you lead.
Yeah, Francesco, thank you for having me. Vital Options International is a 501c3 nonprofit, and we help patients who are living with a chronic terminal or rare disease with information, education, and short-term financial support as they're battling their chronic terminal or rare disease. That's the Vital Options International piece. The Medtera Healthcare Intelligence is our consulting firm, and we work with clients across the whole healthcare delivery continuum, from providers to payers to pharmaceutical and biotech companies. And we help them understand technologies and how to leverage that technology to bring new products to market faster.
Fantastic. So last time we spoke was 8 months ago in the middle of the pandemic. Now we're hopefully heading out of the major emergency, even if we have some worries about the future, obviously, with the fall coming in a few months. But tell me a little bit about your perspective about what has changed, and where do you see the contribution of artificial intelligence in your space, specifically from your perspective and those two organizations that we mentioned before?
Yeah, that's a great question, Francesco. What hasn't changed? I mean, gosh, with the pandemic and with our work environment, the way that we collaborate, everything's changed. The interesting thing I think about the health space and the utilization of AI, machine learning, digital assistants, is that there's so much fragmented data. If you look at the healthcare delivery continuum from a patient having an episode to being treated, to pharmaceutical companies developing and bringing to market new and innovative therapies, there's so much siloed data. And if I think back pre-pandemic, a lot of meetings going on, right? A lot of face-to-face meetings, a lot of collaboration. I think the utilization of AI and machine learning embedded into those processes deeper is now allowing these companies to understand and look at, rationalize data in a much faster way. And I think that's the good news. I think we're still, as a healthcare industry, in the infancy of really understanding how to leverage AI and machine learning. I look at some other industries, consumer packaged goods. You look at Amazon, for example, and their utilization of AI. We can learn a lot as an industry from those other industries. But getting back to healthcare, there's so much siloed data, and data comes in different forms. It's very disparate. And the thing that I like about AI is it can rationalize that data. It can normalize that data. The machine learning end of it is, it's just like a young brain. It's always learning. It's taking data. It's looking at historical patterns. It's developing and forecasting what the future could look like. So I don't, a lot of people, I think, talk about AI and machine learning and digital assistant technology, voice recognition as individual pieces of technology. I think the leading companies, as you well know, with some of the work in the industries you do at Querlo, the successful companies are learning how to take those tools and build an end-to-end solution and deploy those in a business process to get information faster, more accurate information. It's always learning. It's always teaching us something. And, history is a teacher for sure.
So you mentioned in the past recently about vital resiliency. Can you share with us what this initiative is about and where do you see the application of AI in a space like this?
Yeah, so vital resiliency is something that we're collaborating with an organization called Vital Hearts on. And Vital Hearts has been doing resiliency training for healthcare professionals since 1999. And they're very, very good at it. Their curriculum, their methodology, their approach to the training is world class. We are collaborating in a way that allows us to really identify leading indicators of depression, stress, burnout of healthcare professionals rather than lagging indicators. And AI and machine learning plays a big role in that. When you talk to a healthcare professional, especially that's gone through the pandemic, that's worked 18 to 20 hours a day, no rest, sleeping on the floor in the healthcare institution, about stress and burnout, they're going to say, yeah, that was a really stressful time. I'm so burned out. What we want to do is use AI and machine learning to identify what are those leading indicators that one might experience or feel before they get to the point of raising their hand and saying, I'm burned out, I'm stressed out, I've had enough, I'm getting out of patient care. It seems to me, it's a little late in the game to try to repair when something like that's happened. If we can use AI, we can use digital assistants, we can gather real-time information, not just when somebody's stressed, when things are going well also. I think we'll learn so much and we'll be able to head stress and burnout and leaving patient care. We'll be able to head that off at the pass. That's my hope.
Okay, fantastic. David, thank you very much for your contribution. People want to learn more about this initiative. What's the best way to learn more?
Well, if you're interested in the resiliency work that we're doing, you can go to vitalresiliency.org. If you're interested in what we're doing in terms of helping patients with education, information, and short-term financial support, we can be found at vitaloptions.org.
Thank you very much.
Thank you, Francesco.